Hello, everybody. This is Mr. Wyatt, the externship coordinator here at Dorsey College Madison Heights campus. Today, we are going to be talking about your evaluation that you're going to receive at the end of your time at your externship site. So your evaluation form is what is completed by your site supervisor, and it determines the grade that you get. So we're going to talk about how to find your evaluation form. We're going to talk about what's on it, both clinical skills and administrative skills. We're going to talk about the minimum requirements needed to fill out the evaluation form. And we're going to lastly talk about how you can give your chance for yourself to learn the most at your externship site and to have the best experience possible and get the best grade that you can. So the first thing we're going to do is go to this website. This is our Dorsey Edge portal. And we are going to log in. I'm going to log in as a student so you can see what it's like from a student perspective. So we're going to go ahead and log in. And once you are logged in, you'll see this timesheet button up here. Now, if you were to log in today, you would not see this button there. It only appears once you have been paired with an externship site. So if after this video you go on and you test this yourself and you don't see the timesheet button, do not worry. It will be there once we have chosen an externship site for you. So during your externship, Dorsey Edge is going to be the way that you log your time. And as you'll see in a second, it's also where your evaluation is. So we're going to click on timesheet. This is going to take you to your week by week timesheet. And we'll discuss how to do your timekeeping in another video, but you'll see your name here. You'll see the day you started. You'll see the office that you're at, the program that you're in, and the campus that you attend. Now you also see this button right here that says evaluation. So this is the evaluation that is used to determine your grade at the end. It starts off with all of your basic information, your name and the location and name of your site that you're at. And then we get into this scale of scoring different items. So this first section, well, first let's talk about the scale. So it's a simple 1 through 5 scale. And you can see the key right here shows that 1 is bad and 5 is the best. So if you got 1 in things, it's your supervisor's way of saying that you really lack in that area and need to gain that skill, get more practice in, and really that's an area to focus on. We don't want to see any 1s in any areas. 4, 5, these are what we are really aiming for, and this shows that you're confident in that skill and that you have the knowledge of that skill. 3 is kind of your mediocre. Maybe you know the skill, but you're not really sure how to perform it. And anything below that is unsatisfactory and something you really need to work on. So this first section is mandatory skills. And so you can see that these items are things that you would do anyway in any office that you go to. So we have interacting with patients, interacting with office staff, and following HIPAA procedures. So again, these are things that you would do at any office anywhere. It's just done by nature of being there. So what does this mean? Your interactions with the patients. This includes things like your attitude, your presentation, your professionalism, the words that you choose to use, not using slang, but speaking professionally, being timely, being kind, being understanding with patients, being patient with them, being helpful with them, answering their questions, or if you don't know the answer to their questions, finding someone who does, interacting with the office staff. This is your rapport with your coworkers. How did you get along with everybody? Were you a team player? Did you always try to jump in and help where you could? And then lastly is HIPAA procedures. So this is following rules and regulations regarding confidentiality, the protection of patient information and records, okay? So then we get into administrative and clinical skills. And I should point out that this evaluation that we're looking at right now is specifically for medical assistants. And I'm using that one because that is our largest program here in allied health at Dorsey College. So this covers the majority of our students, but there is a different evaluation if you're in our medical administration and billing program or our dialysis program. Now, they all will have these three skills. This is true for all three of them. But once we get into administrative and clinical skills, that's where things start to differ a little bit. So if you are in one of our other programs, or if you're in our MAB program or our DPCT program, I encourage you, stop by the office, stop by Career Services office sometime. And I would be happy to print out a copy of what the evaluation will look like for your particular program. So that way you can get an idea of what this will look like. So you can see this says administrative and clinical skills. So when you go to an externship site, it's not going to just be clinical skills. It's not going to just be vitals, just be EKGs, just lab tests. You're also going to be doing some administrative skills. You would be very marketable to learn both administrative and clinical skills, because many offices, especially some smaller offices, want somebody who can work both the front and the back office. So you would do well if you can learn both and market yourself that way. That is why we want you to have exposure to both of them during your externship site experience. So you can see that you must be evaluated on a minimum of 12 skills. If you have 10 skills, 11 skills, 9 skills, anything less than 12, we have to send you back to your externship site so that you can gain more experience to be able to get the grade for your externship site. So there is a list of 26 different things on here. 26 different skills that you can do, and I'm just going to quickly scroll back and forth through them so you can read them, and then we will talk about them more in depth. But you can see number 25 and number 26 are spots for other. So there are some skills that are unique to certain offices that maybe aren't on this list of the other 24 skills that are on here. So for example, a couple things that I've seen are students that have been able to learn how to do casting. Okay, they've been able to cast, broken bones or after surgery. That's something that they've been able to learn. That's not on here. That's not a skill that's on here, but it's okay for your site to add it. X-ray is another good example of one that is not on here, but something that you could possibly have the opportunity to learn depending on where you go. So if you think of something that you did that's not on this list, please talk to your supervisor about it and make sure that they add it in this section that says other. And there must be something typed in these boxes. So, when you're filling out the evaluation with your supervisor at the end, and it should be something that's done together, so that way a conversation can be had about your skills and your skill level in each thing that you're being scored on. Make sure that something is in this box. So sometimes I've seen it left blank, but I've seen a score over here. So you get 5 stars, but this is blank. So what are you getting 5 stars in? We have to have something there in the other box. So when you sit down with your supervisor, make sure that they have something in that box. Now, let's take a look at some of these skills. Again, they're both administrative and clinical. You're going to see it starts off with a lot of administrative skills: telephone technique, appointment scheduling, patient registration and checkout, accounting. This can be part of billing or entering co-pays, operating office machines. That's your faxes, your copiers, your computer and keyboarding skills may be evaluated. Filing and pulling charts, insurance verification. So up to this point, we haven't even gotten any clinical skills in. We're focused on administrative skills because, again, we want you to be a well-rounded medical assistant, having both clinical and administrative skills. So then we move on to things like CLIA, and then we start to get into more of these clinical things, such as vital signs, assisting the physician, charting, phlebotomies, specimen handling, lab procedures, aseptic procedures, post-procedure patient treatment, EKGs, PFTs, medications, injections, lab room, stock inventory. We have EHR, HIPAA, and OSHA standards. So this gives you an idea of the different things that you can be evaluated on. Now, depending on what kind of site you go to, you may not do all of these skills. Again, you only need a minimum of 12, okay? And there's a reason for that. It would be almost impossible to find a site that does all 24 of these. So for example, you may go to a EKG doctor. Well, at an EKG doctor, you're probably not going to be doing urinalysis, right? So that's one thing you may not do. The PFT procedure, that's a breathing treatment, okay? That's going to be done more at your like allergy kind of locations, allergy, asthma, pulmonary, that kind of area of medicine. But if you're at a foot doctor, you're probably not going to do a PFT. So again, depending on where you go, that's going to be the clinical experience that you get. Now, I do want to say some students are concerned that they're not getting all of the clinical experiences, skills rather, that they learned while they were at Dorsey by going to some of our more specific specialty sites. I do want to say you're always welcome to come to campus and practice any skill that you may not have the opportunity to do at your site with one of our teachers. Our teachers are always welcome and available to help you with any of those skills. And that also is true for any skills that you may be struggling with that you are supposed to do at your site. So maybe you're at your site and you're doing a blood draw, and after a couple weeks, because it's normal to be nervous at first, that's perfectly normal. But maybe after a couple of weeks, you still find you're struggling with it. Come back to campus, schedule a time with one of our instructors to practice those blood draws, and they would be happy to help. So that covers the clinical and administrative. And then of course, there is a section here for the supervisor to put comments, and things are calculated. So basically, you take the total number of this section here and the total points of this section, the second section here, and we're going to add those together, and then we're going to divide by the number of skills that you were tested on. And that's going to give us a grade point average. So for example, if we pull up our calculator, if you did the 3 mandatory skills in the beginning and the 12 skills in the next section for a total of 15 skills, let's say you got 5s in all 15 of those skills, okay? So you can say you got 5 and 15 of them. So 5 times 15 is 75. So you have 75 points divided by 15 skills equals a 5. That's an A. That's a perfect score. Okay, so you can see how your score is calculated. It is the number of points, 75 in this case, divided by the number of skills that you did. That gets you your grade point score. Okay, and then that's translated into a letter grade, of course, 5 being an A in this case. Now, just to give you guys some insight, this should be objective, okay? It should be an objective, how good were you at your skills? It should be an objective grade, an objective evaluation of your blood draws, of your tests, your ability to do various tests, your ability to gather vitals. It should be objective. But of course, we all know that we have feelings, we have emotions, and a lot of times those feelings and emotions go into things such as this evaluation. So how the site felt about you, how the supervisor felt about you. And that's based off of things like your attitude, your attendance, your willingness to help out, whether you have a smile on or not every day, your timeliness, your politeness, your professionalism. All of those things Although it doesn't say on here, student had a positive attitude, student showed up on time every day. Although it doesn't say those things on here, I guarantee you, your supervisor will take those things into account when they are grading you. Okay, that is simple human nature. Those things will go in, and the more professional you are, the better attitude you have, the more likely you are to get a better grade. Now, what I always encourage students to do is to pull up this evaluation about halfway through your externship site experience, because you want to see, do I have a minimum of 12 skills to be graded on? And if you're going through and you're counting, you're only seeing maybe 6, 7, 8, something like that, and you realize, well, I haven't done enough skills. I haven't done a minimum of the 12. This is the perfect time to talk to your supervisor about how you can get in more skills so that you will have a complete evaluation. It's very important that you get a minimum of 12 in order to complete this evaluation. So there you have it. That is the evaluation form in a nutshell. That is how you will get your grade. Again, you need 180 hours to pass externship. So there is both an hours requirement and then a grade requirement, a passing grade requirement at the end. So again, if you ever have any questions, please feel free to stop by Career Services, and we would be happy to answer anything that we can. Thanks so much, and I hope you have a great day.